nurse practitioner student, and I'm going to be doing a adolescent 16-year-old well child exam as well as a sports physical. So today I'm seeing Elizabeth. She is 16 years old, no significant past medical history. She's presenting for a routine adolescent well child exam and sports physical. She denies any recent fever, illnesses, chest pain, shortness of breath, syncope, dizziness on exertion, no palpitations, no history of a concussion, no known drug allergies, no seizure activity, musculoskeletal injury that would limit any activity. She denies any prior hospitalizations or surgeries, no medications or drug allergies as stated. Her nutrition is appropriate. You have a well-balanced diet, eating 3 meals daily, getting your protein, your vegetables and fruits in, great. Drinking lots of water, staying hydrated, good. Sleep about 7 to 8 hours a night? Okay, good. Immunizations have been reviewed and updated. So at this point of the exam, I would ask to speak with Elizabeth privately and have her mom go sit into the waiting room so that way I can get a confidential heads assessment on her. For the heads exam, it'll be a social history. I would explain that this is completely confidential unless it has anything to do with self-harm, harming someone else, or any safety concerns. First, we'll start with home. Do you live at home with your family? Do you feel safe at home? Okay. And then education, you're currently in high school. Are your grades going well? Okay. Any concerns, any feeling like you can't focus at school or grades are slipping? Good, okay. No school concerns reported. You participate in sports. You said you had regular physical activity. You have a good supportive friend group at school. Next, we move on to drugs. Any tobacco use, any vaping, any nicotine use, no alcohol. What about marijuana? Okay, no other substance uses. Okay. And then sexual, denies any current sexual activity. We will go over safe sex, consent, and STI prevention. Suicide and depression, any concerns with depression or anxiety at this time? Okay. No suicidal ideation, no homicidal ideation. Okay. No self-harm. Okay. And mood is stable. Do you use a seatbelt when you're in the car? Okay. Helmet when you're on a bike or riding a scooter. Safe driving. If you're behind the wheel, make sure you're not texting and driving, okay? Sunscreen when you're outside is super important, so continue to do that. And then we went over the driving. At this point, I would go ahead and get a full set of vitals, which would be all within normal limits. Respiration 16, blood pressure is 110/62, heart rate is 74, no palpitations noted. Normal temperature 98 degrees, and SpO2 is 100% on room air. Normal weight 126 pounds, normal height, she is 5'4", and her BMI is within the appropriate growth chart. Patient is alert, well appearing, and well developed, well nourished, no acute distress. She is cooperative throughout the exam. So now I'm going to start my physical exam. I'm going to palpate your head. Normal cephalic, atraumatic. No pain with any of that. Okay. No lesions or deformities noted. I'm going to now look in your eyes. I'm going to shine a bright light. I'm just going to have you stare out in the distance. Pupils are equal and round and reactive to light. Conjunctiva is clear with no drainage. Next, I'm going to take a look into your ears. Externally, there are no lesions, no external concerns, and tympanic membranes. Clear. And intact with no arrhythmia or bulging. Next, I'm going to look into the nose. nares are patent. Bilaterally, nasal mucosa is pink without significant congestion or discharge. Okay, I'm going to have you say ah for me. Okay, perfect. Oral mucosa is moist, dentation is appropriate. Oropharynx was clear without arrhythmia, exudate, or tonsillar enlargement. Next, let me know if you feel any tenderness, okay? Then I'm going to have you turn your head side to side. Perfect. Okay, neck is supple with full range of motion. No lymph nodes palpated. Thyroid is not palpable. And no masses were noted. Okay, so chest wall is symmetric. Respirations are even and unlabored. I'm going to take a listen to you now. I'm going to listen anteriorly and posteriorly. Listen to your heart sounds. Respirations are even and unlabored. Breath sounds are clear and equal bilaterally. No wheezing, crackles, or rhonchi. Heart rate was regular and rhythm and rate was regular. Normal S1 and S2. No murmurs, rubs, gallops, or clicks. For sports physical, I could also consider to do a assess for murmurs and with position changes if indicated. I listened to her abdomen in all 4 quadrants. Now I'm going to feel for her radial pulses. Those are equal and normal bilaterally. All 4 quadrants had vowel sounds. Any pain or tenderness when I palpate? Okay. Right. Abdomen is soft, non-tender, and non-distended. No masses were noted. She has good range of motion and full strength. No joint swelling, tenderness, deformity, or obvious musculoskeletal injuries. Okay, I'm going to have you now stand, and you're going to put your hands together, and then you're going to bend down, and I'm just going to assess for scoliosis. Okay, perfect. You can stand up. No scoliosis noted. Any rashes or anything that you've had? No. Perfect. Okay. Now I'm going to have you do a couple of those tests we talked about. So I'm going to have you take a couple steps on your toes. Perfect. And then a couple steps on your heels. Perfect. And then a squat. No, you're good. Okay, and then we would do the duck walk here as well. Okay, you can sit back down. Good range of motion there. Throughout the exam, the patient has been alert and oriented. Speech has been clear and appropriate. Cranial nerves are grossly intact. Her strength was 5 out of 5. Upper and lower extremities bilaterally. Can you feel this appropriately? Feel that equally? Sensation is intact to light touch. Coordination is intact. I'm going to have you touch your nose and then touch my finger. Okay. Coordination is intact with the finger to nose testing. Her gait was normal. Going to now check your reflex. so this is a healthy 16-year-old adolescent presenting for a well-child exam in sports physical. History and physical exam are reassuring today. The plan is to continue to go over routine health and maintenance, encourage we're going to continue to encourage a healthy diet as well as hydration, physical education, and your sleep hygiene. It's important for you to still follow up with your dentist at least every 6 months, okay? Routine vision and hearing is needed. Currently doesn't need any classes. You are cleared for sports participation, but if you notice any concerning injury or anything, please report that immediately. All exam findings were normal today. We went over the healthy diet and hydration. We talked about our seatbelt use, helmet use, sunscreen, and injury prevention. Continue to avoid your tobacco, substance use. We went over her mental health and stress management, and when to seek help. And then we went over safe relationships and consent and sexual health, as well as safe driving and avoiding texting. For immunizations today, it is recommended that she gets the meningococcal booster, as well as meningococcal B may be discussed. She is currently up to date on her flu and COVID vaccine. And we will see you in a year unless anything changes, but we'll see you next year, okay? Good luck with school and your sports, okay?